Welcome. Today we will focus on EQuIPP training for seasonal influenza immunization status. The seasonal influenza immunization status measure, which we will refer to as the flu measure, is important because it helps identify patient opportunities for pharmacies that can help increase vaccination rates for flu. It is important to note some of the measure specifications. The measure is based on both pharmacy and medical claims billed to the patient's insurance coverage, and the metrics are based on the HEDIS dataset. The eligible patient population are those members aged 18 years or older, and the patients are attributed to the pharmacy if they have filled the majority of their adjudicated prescriptions at that pharmacy during the given measurement period. The performance for this measure is based on this. The denominator are all patients aged 6 months or older. The numerator are patients who have received a flu vaccine for the current flu season, and the score is derived by dividing the numerator by the denominator. Outliers are patients that have not received an influenza immunization during the current flu season. Then the action or solution is to assess the patient's status and history, contact and counsel the patient, and then provide the flu vaccine to them or refer them on to their physician if deemed appropriate and, of course, accepted by the patient. Let's review where to find the seasonal influenza measure on EQuIPP. Begin on the Performance Dashboard tab. Go to the View As bar and click on the Immunization button. This slide highlights exactly where to find the immunization bar. Click on that and you will then see the measure. On the left-hand side, it is called influenza immunization, the trend, the number of patients that are falling into that measure, your store's performance score, the goal, and then the gap, and how you compare to the state that you work in. For a deeper dive into the information, you click on the Analyze Performance bar underneath your performance score. From here, you will see your total number of patients under planned patients, the plans that they belong to, and some other comparative information such as the all EQuIPP average. When you go back and return to the performance dashboard, you can then click on the outlier button. Then your outliers, those folks that have not had the flu vaccine, will display. You can see their last name, first name, date of birth, the plan that has provided the information, and then you have the option to address them using the action clipboard. Click on the action clipboard and you will see choices to document your intervention. It is important to note that in some cases, pharmacists may find that the patients on the outlier list cannot actually be impacted by their services. These instances may include the health plan does not have all of the applicable medical and pharmacy claims for the patient's history. The patient may have received a flu vaccine that was not billed to the health plan, perhaps at a community health center or something of that sort. Or the patient has a contraindication to the vaccine. Whatever the case may be, it is still good practice to document the assessment and intervention using the action clipboard. A few notes about EQuIPP reporting. Keep in mind that only events or claims that occur during the measurement period truly impact the performance score. Your actions, although important, do not affect the performance score. Claims adjudicated after the performance data date range are not yet captured in the score. However, those claims will be captured in subsequent EQuIPP refreshes, and that occurs roughly on the 15th of every month. The action documentation is really important to help you and your staff track your interventions and how you are handling quality improvement. But remember, those actions do not impact the performance scores. So be equipped. Here are some tips to remember. Currently, pharmacies do not get a star rating. It is the health plans that are rated by CMS. However, pharmacies may be evaluated by plans. EQuIPP is refreshed with new plan data every month, middle of the month. Any text written in bright blue is a link to more information. Whenever you see the question mark icon within the circle, hover over that for more detailed information. An outliers button will only display at the individual pharmacy level if the pharmacy has patients that fall under the health plan that has chosen to share that level of detail. Refer to the FAQ tab for any question you may have. Use it as your first line of defense. Refer to the Resources tab on EQuIPP for quality improvement tools and more. Know your numbers and where your pharmacy stands. Thank you.